because, like, I work damn hard for my title. So put some respect on my license immediately, expeditiously. Put some respect on what I'm doing, because I work damn hard for it. Respect my title. Okay? Now that's that on that. Hello, my beloved is okay. So this video is gonna be a little bit different, okay? Because normally on my channel, on my TikTok, on my Instagram, any social media that I have, I'm always encouraging LPNs. I'm always talking about the pros, the benefits, and how amazing it is to be an LPN. But can we just get into the hair for a second? The hair is herring. The hair is herring. And yes, it's all mine. Y'all used to seeing me with wigs and braids and all of that. No, this is me. This is all me. This is Brittany. Okay? This is her. This is she. Okay? Now let's get back into it. Okay? Because that was a little off topic. Let's get back into it. So for this video, I want to do something a little bit different. And instead of showing the positive, the great, the most rewarding, the pros of LPN and being a licensed practical nurse, let's get into the cons. Because we got some cons. Let's get into those cons. Okay? And before we get into those cons, this video is not to discourage anybody. This video is not to make you feel as if going for your LPN is the wrong route, is not the right thing to do. This is just simply to show you the other side, because I'm always talking about the amazing side. So let's get into it. Now for me, as an LPN, my very first con is simply constantly having to remind people that I am a nurse. That is your number one con. Literally having to remind people that you are a nurse. I don't know. I honestly don't know what the problem is. I don't understand the disrespect of our title. I don't understand why we're kind of looked at as if we're the bottom of the totem pole. I don't really understand it. Because, I mean, honestly, if it's life or death and I'm in the hospital room, I don't give a damn who. I don't give a damn if it's monkey see, monkey do, come and work on me. Save me. I don't care what your title. Save me. I don't care if you're black, white, orange, purple. I don't care if you're Muslim, Jewish, Christian, Satanist. I don't care. I don't care. I don't care if you got a little bit of nursing. I don't care if you are associate, masters, judicial system. I don't give a damn what you is. If it come down to life or death and you here to help me, help me. Help me. I'm not waking up out of a coma and saying, don't touch me. She a LPN. I don't care. Help me. Save me. Okay? Let's start there. I don't understand the problem that people have and the disrespect for who we are. I don't understand it. It is a career. It's not a job. It's a career. Like, this is a lifelong fulfilling career. I don't understand the issue with, oh, you an LPN? I don't understand it. That is the number one con for me. Annoying as hell. It's very disrespectful. Let's make that clear, because it's disrespectful as hell. And I just don't get it. I don't understand why people act as if you say, oh yeah, I'm a nurse. Oh, what kind of nurse? You're RN? No, I'm an LPN. The whole face change is like, oh, you're an LPN? Well, when you going back for your RN? Mind the business that pays you, because my career is paying me very well. Clock that too. Okay? But let's get into the next con. Number two. As an LPN, and I literally just had this conversation the other day with another RN that I absolutely love and adore. I'm going to sneakily say her name because I don't need people knowing where we work. But Keisha, I love her so much. She is absolutely amazing. She is the educator of the hospital that I work at. Well, the unit that I was on. She was our educator. And then she moved on up, but that's neither here nor there. So just left us, but it's okay. I still love you anyway. I hope you see this video. I hope somebody tag you, my girl, Asia. But let's get into it. We literally just had this conversation. And the conversation was, we don't understand why, as LPNs, number one, I went through an accelerated program. Literally the entire program, all of the instructors, which were RNs, had their bachelor's, their master's, things like that. They continuously told us in the program that this was the hardest program we would ever have to endure. And they constantly told us that their RN programs had nothing on our LPN program. And they would remind us when we would get discouraged and when we would like feel like we can't do it. Like, you have to remember, you're learning an RN's curriculum in a little over a year. And in some accelerated programs, I don't know how the hell people do it, but some people are in accelerated programs that are only 11 months. Are you out of your... I would be on the nearest bridge. I'm diving head first because there's no way. I don't know how y'all do it. Because, baby, them 15, 16 months wore me out. I don't know how y'all doing it in less than a year, but more power to you, because absolutely not. Not for me. I ain't trying to discourage you, but not for me. Hell no. Hell no. But anyway, so we had a conversation and we were saying that we are literally taught as LPNs the RN-based curriculum. We have to sit for the same NCLEX. We have to go through most of the same courses, okay? We are literally taught all of the dosage and calculations, and we go through hell just like the RNs. Why is it that I'm competent enough to be a nurse, but I'm not competent enough to do something as simple as pushing an IV medication? When I've gone to class and clinical and studied and practiced for it. It would be different if it was like just a little lecture and they kind of scoot on over it and you don't know. We are literally taught this in nursing school. We are taught it. But yet when I get on a job, and it depends on your state and your facility. I live in Louisiana, and here we ain't pushing no IV medication. We can do IV piggybacks. We can start IVs. We can flush. We can do heparin, saline locks. We can do all of the things. But when it comes down to pushing an IV medication like a pain med or a cardiac med or something like that, we're not supposed to do that. And it bothers me because it's like, since I can't do it and I may have a patient that is prescribed some type of IV medication, I then have to get up and go ask an RN, hey, can you come and push this med for me? In the hospital specifically, you are going to get people that literally are med seekers. And when I say med seek, I'm not talking about med seeker, blood pressure medication or whatever. You have people that are going to med seek, and I hate to say it because pain is always whatever your patient say it is. Whether they acting like they're in pain, whether they look like they're in pain, whether you think they're lying or whatever. Pain is whatever your patient says it is. So if your patient says it's a 10, but they laying there laughing and kicking on their phone, it's a 10. You as the nurse cannot say, oh, you ain't really hurting. You ain't acting like you hurting. If they say that it's a 10, you chart that it's a 10. And if they have morphine or Dilaudid or whatever order, you have to give it, whether you believe them or not. It is whatever that patient says it is, that is their pain. If they in there having a good old time and all of a sudden they call you and they say that they're experiencing anxiety out the wazoo, even if they look calm and collected and chill and their vitals is showing that they're perfectly fine, guess what? You have to get, it is whatever that patient says it is. So now I gotta go get Ativan, and because I'm an LPN, if it's IV, I can't push it. I have to go ask my RN. And I really and truly hate that, because a lot of times it can come off as if we're bothering the RNs. It can come off as if we're getting in their way. Some of them have this attitude as if they don't want to help. Like, you're an LPN, you a nurse, but you still got to ask me for help. And I don't feel like doing. It's not all RNs. It's really not all RNs. But it is a vast majority of them that really have this persona, this aura, and this presence. Like, you less than me, and why are you here? And now you need my help. That is the second kind for me. I hate the fact that we are literally mentally, knowledgeably, clinically proving that we can do something, that we are competent enough to do it, but the board of nursing says, yeah, you a nurse, but you just not a little bit enough of a nurse to be able to push this pain medication. It's not rocket science to do the math. It's not rocket science to read the vial and to read the MAR. It's not. So it's like, why is it that we have to then go to someone else to ask them for help for that? That is annoying as hell. That is my second kind. I hate it That is the one thing that I wish I could do as an LPN. Honestly, if I could do that as an LPN, I would never go back for my RN. I'm going to be 100% honest with you. And it's not even a money factor. If I could go in and be able to push my own medications, initiate and start all of my own blood transfusions, because we can't do that as well. We can monitor after the first 30 minutes, but we can't initiate the blood transfusion, even though we're taught clinically, medically, knowledgeably. Y'all know I'm going to mess words up. But even though we're taught it, we can't initiate it. Even though we know all of the signs and the symptoms and what to look for in terms of reactions to transfusions, and even though we understand, blood typing and cross-matching and everything like that, we're not competent enough to start and initiate a blood transfusion. Huh? If 1 + 1 is 2, why y'all acting like it's 3 for us? I don't understand it. Stay bored. Technology is evolving. We is learning. LPNs is everywhere across the board. Please change that. That's so annoying. That's my second kind, okay? Not to piggyback off of that kind, I'm going to have to get into a little bit of how discouraging it can be as an LPN when dealing with other nurses. And what I mean by that is, you have this age range of RNs, right? You have this older age range of RNs. I'm going to say anywhere from late 50s to 60s. That age range right there feel as if we're beneath them a lot of times. Not all, but a lot of them feel as if we're beneath them because we're LPNs. A lot of them act as if when we need something, or we have to come to them, or we have to ask for help, they give you this attitude and this passive aggressive ass way of, well, all right, come on, or okay, I got it, well, when I get time. Or it can be very passive aggressive, and honestly it's very discouraging, and it really makes a lot of people feel like, damn, do I belong here? Because I know when I first started nursing, I would almost feel afraid to ask for help in certain situations dealing with certain nurses, because I felt like I was getting on their nerves. I felt like, damn, maybe I don't belong. Like, they don't want to help me, or I'm in their way, or why am I here? But then as time went on and I had amazing preceptors, and I started working with amazing nurses that were willing to take me under their wing and not just tell me if I did something wrong, but give me tips and tricks on how to become a better nurse, how to work on my time management skills, how to use my critical thinking, how to be confident in my nurse's judgment, how to speak with physicians and not be scared. When I started having that confidence within myself, I got to a point where dealing with them kind of nurses, I was like, okay, you don't want help? Well, you can have all my patients. At the end of the day, you can take this, you can take all of them, and I can go home. I guarantee you 10 times out of 10, they don't want to deal with them patients. They don't want your patients. So what they going to do? They going to help you. They going to help you. But it's the coming to you feeling as if, number one, I would think it's an honor for somebody like me. Like, I'm about to be 30 years old. I'm still young. I still say I don't even think I started my prime yet. So I'm coming up and I'm looking to you and I'm saying, hey, can you help me with this? Or what is your take on this? Or can you give me a little bit of advice on this? I would think that's an honor that you have a younger nurse coming up that cares enough about your input that they want to receive it. And don't get me wrong, I know there are a lot of nurses coming up that don't like to be told anything. And especially younger nurses that don't like to be told anything. They feel as if, well, I'm a nurse too, so I know it. You ain't got to tell me nothing. I'm not one of those nurses. I'm not like that. And that's with anything in my life. If you can help me, if your input is going to help me better myself, better my work, better my career, be better for my patients, be a better woman, be a better mom. If you have constructive criticism that's going to help me, give it to me. Even if it hurts my feelings, give it to me. Just give it here, because clearly it's something that I need. It's something that's going to help me grow. So if I'm taking the time to come to you which is hard as a grown-ass woman. It is hard to have to look to somebody else and be like, you got to put your pride to the side. You got to put your ego to the side a little bit and come to somebody else. That's not easy. That's not easy. So why is it that a lot of times they make us feel as if we're in the way? That's a huge con for me. It is very discouraging. And I would hope that some older RN, and I have to say older because of course they have some younger ones coming up, but I mean I'm going toe to toe with somebody that's my age, because girl, don't play with me. But somebody that's older, I try to have a lot more respect and tolerance when you're older than me, when you're my elder. So it's like, don't discourage us. Don't make it seem as if we're in the way. Don't make it seem as if we're getting on your nerves or you don't want to have to deal with us. Because at the end of the day, we're all nurses. And not only that, we're here to help. I'm another body on this floor that's competent enough legally to practice nursing. I can legally, the state says, NCLEX says, nursing school says, I can practice as a nurse. I worked my ass off for this license. Please don't discourage me by making it seem like, okay, you don't know enough. I don't feel like helping you. I'm tired of having to get up. I want to be a free charge for the day. I don't want nothing to do with I just came here to be here. And you need my help is getting on my nerves. You in my way. Why you got these patients if you're going to need my help? That is so discouraging. And even though you may not say it, body language is everything. Because I can't tell you how many times I have had to ask a nurse, a charge nurse, a RN, okay, can you help me push this pain medication? My patient says they're having pain and this and this and this. Or this patient says they're having, a lot of anxiety, blah, blah, blah. Or this physician put in a stat order of blah, 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 but I can't push it. Can you do it for me? I cannot tell you how many times I have heard the smacking of the teeth when you turn around. When you're walking off. Well, all right. I cannot count how many times that has happened. And it is very crushing as a nurse because it's like, I don't want to have to come ask you. I want to be able to do it myself. I hate that I have to come ask you for help. I hate that I have to come bother you with my patient. And it's not like we don't understand that you have a lot to do because, especially in my facility, I don't know about all facilities, but especially in mine, our RNs, even if they are a free charge for a day, they're never free. They are never free. They're doing discharges. They're on the phone with physicians, NPs, the residents constantly. They have the staff and coordinator calling. They have house soup calling constantly. They are dealing with, outside appointments, having to make appointments for patients. They're having to deal with, social work. They're never really free. So even if I see you sitting down, I know 9 times out of 10, you're busy. I'm just busy ripping and running on this float. You busy, and probably 9 times out of 10, you're overwhelmed doing everything you got to do on the computer, on the phone. And I always say, when you get time, can you, or whenever you have a moment, because I know you're busy. So it's very discouraging, and it's a lot. It's really hurtful when it's like we're in the way. It's very discouraging. And I hope that RNs see this video and they understand it's just as hard as for us to come to you as it is for you to have to be bothered with helping us. It's not easy for neither one of us. It's really not. So that is a con. Okay? That is a con. Number one. Lord, I said number 1 already. Okay, let's get into it. Number 4. Where you can work. And again, this is something that depends on your state. Okay? In my state, in Louisiana, if you are an LPN, especially fresh out of school, you kind of have 2 choices that's very easy to get into. Med-surg and the nursing home. That is your main 2 choices straight out of school as an LPN. I wish that the pay that is offered for long-term care for LPNs was the pay that is offered in hospitals and skilled nursing facilities and in psych and in, you know, other areas. I wish that they match that pay, because that is why so many LPNs get out of nursing school and go straight into long-term care, because they need to make money. We was broke as hell in nursing school. We was hurting, struggling. I know I was broke as hell, because you could barely work, and when you can't work, your dog tired, weighing your body down mentally, you beat the hell up. So you're struggling like hell, and now that you have your license, you need to make money. You have bills. You need to work. You have children to provide for. You have a mortgage. You have a car note. You have trips you want to go on. Whatever the case may be. So you need money. To me, in my personal opinion, it is highly recommended to do at least 6 months to 1 year in med-surg, so that when you leave nursing school, you're on the floor learning your skills. Because a lot of those skills, depending on your state, because I know it's different in every state, but in Louisiana, in nursing homes, 9 times out of 10, you ain't starting no IV. You ain't giving no blood transfusion. You ain't pushing no stat meds. You ain't doing wound care a lot of the times. You ain't doing therapy. It's a lot that goes on the med-surg floor that I can't even call off the top of my head that you're not going to see in a nursing home. I'm saying in Louisiana, so don't get in my comments talking about something. Yeah, I do that. In Louisiana. Okay? In Louisiana, it's a lot of things that we going to do on that med-surg floor that you're not going to do in a nursing home. However, because you need the money, so many nurses straight out of nursing school, LPNs, go run to the nursing home because they need the money. I really wish, especially for the amount of work we do in hospitals, that they would match the pay. That is a huge con. I really wish that they would match the pay and we would have more areas to learn in. Like, be more willing to accept LPNs in ER and things like that, because we're going to learn. We're fresh out of school. We hungry to get it. We hungry to learn it. Put us in a position to learn and make the money while doing it. Because you mean to tell me, yeah, it's dangerous. I don't care what nobody say about a nursing home. It's dangerous as hell for one nurse to have 30-something patients. It's absolutely insane. Absolutely insane. So even though that's dangerous, if all I got to do is push meds and making 30, 40 something an hour, and I ain't using those skills, versus going into a hospital, learning and using all my skills and only making $21, $22 an hour, where you think they gonna go? Duh, they going to the nursing home. They going to long-term care, where they gonna make their money. But then the problem with that comes, okay, now when you want to phase out of long-term care and you want to go into a hospital, a lot of hospitals looking at you like, well, you've been a nurse for 2-3 years now and you don't have no experience other than the nursing home. You're going to be shell-shocked like hell. Okay? You're going to get on that floor and it's going to be like, what the hell did I sign myself up for? Because I had them days and I went straight into the hospital. I went straight into med-surg. And I had so many days where I was like, damn, I don't know if this really for me. I'm happy I did it now. I'm so thankful I chose that route now. Because when I would pick up at nursing homes and things like that, I would see the difference between, and it's not to shit on no nursing home nurse. It's not to make them feel like they're less than. It's not to downplay what they do. But you can clearly see a difference between a nurse that has only done nursing home and that's all they know, and a nurse that's been in places like a hospital, in psych, in a prison. You can see the difference. And it's not saying that there's anything wrong with the difference, but you can tell where a nurse came from, if that makes sense. But I feel like if they paid more money in these more acute settings with acute care and the acuity is out of the wazoo, if they gave more money, more nurses fresh out of nursing school would be more willing to go into those environments. So we're very limited in a lot of ways for what we can do, depending on your state. That's kind number 4. for me. Okay? Lord. Number 5. And I think this is going to be my last one. Number 5. If you did like I did and chose the accelerated route, you have to go back to school, right? Right. We all know that. However, like the college that I chose to go through, none of my credits will transfer to a lot of universities. So that means all of my A&Ps, all of my sciences, my Englishes, things like that, I have to take all of that all over again. All over again. Depressing as hell. Who want to have to go through all that again? Who? So keep in mind, for kind number 5, depending on the type of college, technical school, whatever you choose to go through to get your LPN, make sure you look into the fact of what will it take when you finish to go back to school. Will you have to repeat those classes? Will those credits transfer over? My God, Brittany. Will the credits transfer over? Will you be able to easily get into other schools? If you try online programs, look in your state to make sure that your state is willing to choose or accept certain accredited programs, because in Louisiana, there's a lot of things online that you can use to do your prereqs that Louisiana won't accept. Like Excelsior is a big one. Accepted damn near everywhere in the country except Louisiana. Why? What sense that mean? I don't understand it. It can be so hard to go back to school for your RN. It can be so hard. It can be so challenging. And I think that is my last and biggest con. It is so hard to go back to school. I'm sorry, y'all. I had to get a sip of water. Plus the train was passing. But anyway, let's get back to it. So it can be very, very discouraging to get back into school. Like literally, it's hard, y'all. Like it's hard. Like I cannot count how many schools I have called. And then it depends on your situation. It depends on if you are looking to go back to more of an online based program. If you want to be sitting in a classroom. LPN school traumatized me. I cannot go back to sitting in a classroom 4 or 5 days a week. I can't do it. It has to be online for me. It has to be online. My clinicals in person, absolutely. But my coursework, classwork, it has to be online. I can't go back to sitting in a class 4 or 5 days a week. I will crack up if I have to do that again. So it's finding a program that fits into your schedule, that is accredited, that your state will accept. And then not only that, you have to find something that's going to work with you being able to still work while you're in school. I feel like they make it so hard to be able to work and go back to school. And I don't know why. I don't know why they make it so complicated to further your education. Going from LPN to RN. It's so difficult a lot of times. And I know some people are going to be in the comments but like, oh, well, I went right back and it wasn't hard and all I had to do was such and such. Depending on everybody's situation is different. It is very difficult for some people. Like I have friends that are like, I don't know when I'm gonna be able to go back. Like I'm trying, I'm doing everything I can, and it just looks like it's not gonna happen. It's hard, y'all. It can be very hard to try to further your education. So that would be my 5th con for me. I only have 5 because I mean I'm so blessed to be where I am. I'm so blessed to have a career. I'm so blessed to have something where I'm actually getting paid to do something that I love. I love my patients. And I mean, being an LPN is awesome, y'all. It is awesome. Even if you decide you don't want to go back and further your education, being an LPN is enough. You are enough. Y'all know I have to end all of my videos with some encouragement. You are enough. I don't care if you decide to never do anything else other than be an LPN that works in a nursing home. If that's what works for you and your family and that is your calling, that is your calling. It is enough. If you decide I stressed and struggled enough during LPN school, I'm not going back for my RN because I simply don't want to, You are enough, y'all. Being an LPN is enough. So please, please don't let these cons that I finally talked about, please don't let these cons discourage you or deter you from going to get your LPN. I promise you it is worth it. It is everything you could ever imagine in your wildest dreams. Nursing school is a short sacrifice for a very, very long term rewarding goal, y'all. It is absolutely amazing. But I'm always telling y'all the positive, so I had to come and tell y'all some of the negative. Okay? Other than that, I hope y'all like the cons video. If I can think of more, or if y'all have more questions, put them down in the comments below, and I'll comment as soon as I can and as soon as I can see it, because I be forgetting to check them. But y'all, charge it to my head, not my heart, okay? I love y'all. I hope y'all enjoyed the video. Until the next time, love you guys. Bye.